Hi everyone. I'll be presenting in English today. I hope that's okay. Hello everyone. Yes, my name is Emily Russel, and I'm a first-year master's student who is working in the clinical exercise and respiratory physiology at McGill under the direction of Dr. Dennis Jensen. And today I'm excited to talk to you about the use of oral cannabidiol on markers of systemic and pulmonary inflammation in people with chronic and obstructive pulmonary disease. Sorry. So something we may take for granted on a day-to-day basis is our ability to breathe. Controlled by the respiratory centers in the brain stem, breathing is an involuntary process that allows us not only to deliver oxygen to our cells and clear that waste from our body, such as CO2, but it's also what allows us to do our daily activities with ease and exercise in order to maintain physical health. But what if our day-to-day activities like making our bed, brushing our teeth, and walking up the stairs becomes a strenuous activity? And what if breathing becomes difficult? So this is a reality for people with chronic obstructive pulmonary disease. Defined, COPD is a common, preventable, and treatable disease that is characterized by persistent respiratory systems, such as breathlessness, coughing, wheezing, and sputum production, and airflow limitation due to alveolar and airway abnormalities. And this is usually caused by significant exposure to noxious particles or gas, such as environmental pollutants, and especially cigarette smoke. And if we look at Canada today, the Canadian prevalence of COPD among adults aged 40 years or older is 16.2%, which is quite significant. And additionally, the global burden of COPD is continuing to increase. So this definition doesn't quite tell us what an individual COPD feels like on a daily basis. So what does this feel like? So an artist was commissioned to paint illustrations of what the individual experience of living with COPD and breathlessness feels like. And here we see a woman on the left that feels as though she's underwater and cannot take another breath in. And on the right, we see a man who feels as though he's being strangled. So here we can see that the patient experience of living with COPD is quite serious and severe. And this points to the critical need to find effective treatments for this disease. It's also important to note that COPD is characterized by chronic inflammation. And this chronic inflammation has been known to cause various structural changes to the lungs, airway narrowing, and destruction of the lung parenchyma, which can contribute to an increased symptom burden in this population. Specifically, both systemic and pulmonary inflammation play a role in the pathophysiology of the disease, and they are both known risk factors for the development of COPD comorbidities, and they have been shown to be linked to the mortality and exacerbations in COPD. So we'll start looking at systemic inflammation, which is thought to play a critical role in COPD. Some of the primary sources of systemic inflammation include smoking, as well as lung hyperinflation and infection, among others. Unfortunately, chronic systemic inflammation is poorly defined in this population, but what we know through various preclinical and clinical studies is that in COPD, C-reactive protein, fibrinogen, interleukin-6, interleukin-8, and tumor necrosis factor alpha are all elevated. And results from these studies show that elevations in these biomarkers are associated with a significant increase in mortality, disease severity, exacerbations, as well as the development of various extrapulmonary manifestations, including cardiovascular disease, muscle wasting and osteoporosis, as well as the destruction of the lung parenchyma. Moving over to pulmonary inflammation, this also is known to play a critical role in COPD. So pneumoproteins, which are predominantly synthesized by the lungs, are actually the most promising biomarker to assess COPD disease activity. And two common pulmonary inflammatory biomarkers are CLARA, or club cell protein 16, and surfactant protein D. Now, CC16 is secreted by the bronchiolar club cells in the lungs, and it's believed to have an anti-inflammatory property within the airways, which really provides a protective effect in health. So we can imagine that in COPD, this biomarker is actually found to be decreased. On the other hand, surfactant protein D, or SPD, is a glycoprotein that contributes to pulmonary surfactant homeostasis and plays a role in pulmonary innate immunity. And in COPD, this marker has been found to be elevated. So these alterations in these biomarker concentrations have been linked to an increased risk of exacerbation, as well as a decrease in lung function. And this really highlights the need to target these markers through various immunomodulatory treatments. So currently, one of the main immunomodulatory treatments that are used in COPD is oral and/or inhaled corticosteroids. And these are non-specific anti-inflammatory agents that work by increasing the number of beta-2 receptors or by increasing the transcription of various pro-inflammatory cytokines. However, unfortunately, this treatment is associated with adverse health effects, including muscle atrophy. And this muscle atrophy can become quite severe and chronic if these corticosteroids are not withdrawn. So as such, the identification of a novel immunomodulatory treatment with little to no adverse health effects is quite critical in this population. So this is what brings us to cannabidiol, or CBD. So in 2018, Canada legalized the recreational use of cannabis products, and cannabidiol is one of the main phytocannabinoids derived from the cannabis sativa plant that is pharmacologically active, non-psychoactive, and has an established safety profile. And through various clinical and preclinical studies, we've demonstrated that CBD has a high therapeutic potential, especially in diseases that are characterized by inflammation and oxidative stress. You might be asking yourselves, how does CBD act on the immune system? So in general, CBD acts to suppress the immune system through a variety of different mechanisms, which we'll take a look at. So firstly, CBD can reduce immune cell migration and infiltration to the site of injury. So in this case, this would be the lungs. Secondly, CBD is able to block the activation of the production of reactive oxygen species, or ROS. Thirdly, CBD can inhibit pro-inflammatory signaling, which as a result will decrease the pro-inflammatory response. And lastly, CBD has been found to induce apoptosis in a variety of different immune cells, including monocytes and lymphocytes. So specifically, these immunomodulatory properties of CBD have been well studied in a variety of different models. So this includes laboratory-induced inflammatory models, diabetes, arthritis, cardiovascular disease, autoimmune disease, cancer, and asthma. And results of these preclinical and clinical studies show that CBD has the ability to decrease pro-inflammatory cytokines, decrease immune cell adhesion and migration, as I just mentioned, increase T cell apoptosis, and decrease T cell proliferation. So a quite relevant example in this case is a study was conducted looking at the marine model of induced asthma. And here CBD was able to decrease circulating levels of TNF alpha and interleukin 6. And this is quite promising because, like COPD, asthma is an inflammatory airway disease that is characterized by increased circulating levels of these pro-inflammatory cytokines. So what about the use of CBD as an immunomodulatory treatment in COPD? So based on CBD's known anti-inflammatory properties, we can hypothesize that if we use CBD as an immunomodulatory treatment in COPD, it will reduce levels of systemic and pulmonary inflammation. Specifically, levels of C-reactive protein, fibrinogen, interleukin 6, interleukin 8, and TNF alpha would all be expected to decrease with the use of CBD. And when we look at the lung-specific inflammatory biomarkers, we would expect a decrease in surfactant protein D and an increase in CC16 with the use of CBD. As a result, this could result in a decrease in mortality, a decrease in exacerbations, and also a decrease in comorbidities associated with COPD, and therefore lead to an improved health-related quality of life in this population. So because these altered levels of inflammatory biomarkers are associated with the progression of the disease, as well as COPD-related exacerbations and mortality, targeting them with an immunomodulatory treatment is quite critical. And because CBD has quite a high therapeutic potential, especially through its anti-inflammatory properties, its use in the treatment of COPD really presents a safe and alternative method to treating this disease that has quite a safe profile, unlike corticosteroids, and this will hopefully lead to improved COPD health-related outcomes. Thank you. Any questions?